Hi, this is Dr. Stefan. Welcome to another video. In this one, I'd like to talk about a really interesting condition, which is called sarcoidosis. Sarcoidosis is a bit of a mystery condition, and it is interesting because many patients are really frustrated by the time they get a diagnosis because it can take a really long time to actually work through the symptoms and put it all together to make this diagnosis. So let's talk a little bit about sarcoidosis, a little bit about what it is, who gets it, what organs can be involved, how it is confirmed, how it is treated. So let's get into it right now. So basically, sarcoidosis is a condition that can affect multiple organs of the body. It's an inflammatory condition. And the inflammation present in sarcoidosis is something called granulomatous inflammation. Now, this may not mean anything to someone who's a layman who doesn't have medical training. It doesn't matter. So that's less important. What may be important to remember is that there is a certain type of inflammation that is found when a biopsy is done in someone who has sarcoidosis, which may be relevant because you may see this on some reports from the hospital or from a doctor, etc. And this term is called a non-caseating granuloma. Non-caseating granuloma. So sorry for the medical terminology, but I think it's important because you may see this on reports in patients who have sarcoidosis, and it's a fairly good marker that this is the condition we are dealing with, especially if that biopsy was done in the appropriate clinical context. And I'll get into it in a little while. Now, the cause of sarcoidosis is actually not known. So it's a condition that can affect, like I said, multiple organs of the body. There is this inflammation. There are these granulomas that can be found in certain organs of the body where they build up and they affect the function of these organs. But the condition hasn't got an exact cause that we've identified. There have been theories whether this has been something to do within the environment or a reaction to some bacteria that we may be colonized with. There may be a genetic predisposition, but the truth is we don't really know the exact cause for sarcoidosis. Now, who gets sarcoidosis? So generally, it's a condition that can occur in both men and women, usually who are young or middle-aged. So it's not a condition that generally occurs in the very young, in children, or in the very old. It can happen, but it's unlikely or unusual. Generally, it's someone who's in the prime of their life, basically, who would get sarcoidosis. Now, what organs can be involved? I think this is really important to remember. Normally, sarcoidosis is identified when a chest X-ray is performed. So an imaging test for the lungs is performed because it may affect the lymph nodes in the chest, which may appear swollen. Or there may be involvement in the lungs that can also be picked up sometimes on a chest X-ray. So the lungs are one of the main organs that can be involved. Other lymph nodes can be also involved. The eyes can be involved. The skin can be involved. So you may have different rashes on your skin, which may be consistent with sarcoidosis. But other potentially vital organs can also have sarcoid involvement, such as the heart, the nervous system, the liver, etc. So it can really affect a large part of the body, and it can be really variable because some patients may have more extensive disease, some patients may have sarcoidosis limited to maybe one or two organs. Now, what are the symptoms? It's important to note that up to half of patients who have sarcoidosis do not actually have any symptoms when they are diagnosed. They may have a chest X-ray done for a different reason and sarcoidosis is picked up. So that's one thing that can happen. Symptoms may also vary depending on the organ which is involved. So for example, if there is involvement of the chest, you might have breathlessness, cough, wheeze, things like that. If the heart is involved, you may have palpitations or an abnormal perception of your heart rhythm. You may have skin rashes or nodules, which may suggest skin involvement in sarcoidosis. Many patients, however, will also present with symptoms which are more general in nature and not specific to any organ or any particular disease. So patients with sarcoidosis often report that a feeling of tiredness. Some people may develop a fever or a high temperature. So that's also one of the interesting things about sarcoidosis, because these symptoms cannot easily be placed with one specific condition. Some patients may also experience night sweats, weight loss. So again, chest and joint pain. So things that can be associated with many conditions. And that's what leads to the delays in diagnosis usually. Now, how is this condition confirmed? So normally, you would need to have compatible symptoms. So like the ones that I've suggested just before. Then if there are certain patterns on chest imaging, so on chest x-ray, on chest CT scans, this may also suggest that sarcoidosis is present. It's very, very important then to rule out other conditions, because symptoms like I mentioned before, such as weight loss, night sweats, chest pain, tiredness, you may think of heart disease, lung disease, other things, infections. It can be a lot of things that we need to rule out. So especially in the case of sarcoidosis, because the lymph nodes may be involved, it is important to rule out potentially more serious conditions, such as malignancy, for example. So your doctor will run these tests to first look out for the main culprits, the main conditions that can be dangerous, rule them out, and eventually, if everything looks compatible with sarcoidosis, we then move forward with this as a potential diagnosis. Now, if we want to really confirm sarcoidosis, normally we would have to do a biopsy. So we would have to take a sample of tissue from an accessible affected organ to confirm the presence of those non-caseating granulomas that I mentioned before. So that specific type of inflammation that is consistent with sarcoidosis. Now, that biopsy can sometimes be done from a lymph node that is accessible. If there is a swollen lymph node, potentially somewhere here, a surgeon may be able to take a sample very easily from that lymph node. Often, it may be that you will have to undergo a bronchoscopy or a camera test for the lungs, and little biopsies can be taken from the airways or from the lymph nodes in the chest. So that can be done through the bronchoscopy. If there is skin involvement in sarcoidosis, there is a specific rash that is consistent with sarcoidosis, a biopsy of the skin can also be performed to obtain a confirmation by a pathologist that sarcoidosis is the most likely diagnosis in this case. And this is also to rule out other potentially dangerous causes as well. Certain blood tests can also be performed, which may support the diagnosis of sarcoidosis. So for example, on a blood test, a certain marker called ACE or ACE can sometimes be elevated. Not in all patients with sarcoidosis, but if it is, it can be a marker of sarcoid activity. Low lymphocytes can also be found on a blood test, and that's also something that can be consistent with sarcoidosis. High levels of calcium in the blood, again, can be in relation to sarcoidosis. So all of these things tend to be pieced together. Other tests may also be used to evaluate the extent of sarcoidosis in different organs that are affected, or to look for involvement in other organs. So for example, if we suspect that there is lung scarring, lung fibrosis associated with the sarcoidosis, lung function tests may be performed. Generally, they're performed in most cases as a baseline to monitor the condition afterwards. But yes, you would want to see how the lungs are operating in case there is sarcoid involvement. If there are palpitations or feeling that your heart's doing something funny, an ECG or an ECG 24-hour monitor to measure the electrical activity of the heart and pick up any abnormal rhythms, this can be performed. Urine tests are sometimes performed to determine whether there's any issues potentially with the kidneys. An eye exam may be performed to look for eye involvement of sarcoidosis. An ultrasound of the liver, ultrasound of the heart to look for other complications there. MRI scans, nerve conduction studies to look for nervous system involvement. A lot of things can actually be done when we are looking for sarcoidosis. Now, let's get into the prognosis. So, what is the prognosis for someone who has sarcoidosis? It can be very variable. It's a very variable condition. It can wax and wane, it can come and go. So it's one of those conditions that's mysterious in this regard, because we don't really know how to monitor it over time. Sometimes it can be unpredictable. That's what I'm trying to say. So the good news is that about half to up to 2/3 of cases actually have improvement without any form of treatment. It's an inflammation that comes, affects the body in certain ways, but then it tends to go away on its own, which is actually a good and reassuring thought to talk to our patients about. However, that doesn't mean that we don't monitor. We continue monitoring because in some cases you can have vital organ involvement. And this is really where sarcoidosis does become a little bit more dangerous. If we are moving into getting sarcoidosis affecting the heart, affecting the nervous system, or leading to loss of an organ function. So for example, if the liver becomes riddled with sarcoid, or if the lungs become very scarred, that again can pose problems over the long period of time and potentially worsen quality of life, potentially shorten a lifespan because an organ becomes damaged. So obviously we need to be careful. Another potential complication is if there is high calcium, so very high calcium levels in the blood. Can also be dangerous for a number of reasons related to heart rhythm disturbance or potentially affecting the kidneys. So there can be a lot of things that we need to look out for, and we may need to intervene with treatment if some of these things occur. The other major situation in which we might choose to treat sarcoid and not just monitor and watch from far away is when the symptoms are very, very significant and they affect the quality of life of the patient too much. Now, what is the treatment? So normally the treatment is with anti-inflammatory medication. Because it's an inflammatory condition, that granulomatous inflammation we've been talking about, we need to combat that inflammation. Now, not everyone should be treated, like I was mentioning before, unless there are significant symptoms, very high calcium, vital organ involvement, or the risk of loss of function for an organ. We generally do not treat sarcoid, but when we do decide to treat, it's usually a consensus decision between several physicians in agreement with the patient if we should start treatment or not. So anti-inflammatory medication, the first line of treatment for most patients is usually corticosteroids. So steroids, prednisolone, things like that. So usually we start with a moderate to high dose and then taper the dose slowly over a few months. And the minimum duration of treatment is usually about 12 months. So about a year of treatment, anti-inflammatory treatment, to give the body time to resolve whatever triggered the sarcoidosis, which we may not find. But we're trying to reduce the inflammation to prevent further damage to organs or vital organs, reduce the symptoms, make the patient feel better. Problem is, there is always a risk-benefit of treatment because anti-inflammatory treatments like corticosteroids can have side effects. So it's really important in that regard to see whether we can sometimes move to a corticosteroid-sparing agent, which can be something like methotrexate, azathioprine, hydroxychloroquine, and these medications can also help to reduce the symptoms of sarcoid, reduce side effects potentially, but they also carry their own side effects, but it's a different side effect profile. Now, usually the treatment is for 12 months or more, and we need to monitor. So this is really, really important. With sarcoidosis, we tend to monitor the condition as much as we can, maybe every 3 months, 6 months, 12 months, to make sure that there's no relapse, even after everything has improved. I hope this video was helpful. If you have further questions, do leave them in the comment section below, and I'll see you in future episodes. All the best.